Occupations and administrative regulations to order. Appreciate the solid attendance. Madam Clerk, please call the roll.
Senator Adams, Senator Douglas, Senator Higdon, Senator Hornback, Senator Howell, Senator McDaniel, Senator Neal, Senator Nemus,
Present.
Senator Thayer, Senator Thomas, Representative Banta, Representative Bratcher,
Here.
Representative Birch, Representative Flannery,
Here.
Representative Gentry, Representative Herron, Representative Huff,
Here.
Representative Cook,
Here.
Representative Massey, Representative McCoy, Representative Meredith, Representative Miller,
Present.
Representative Moser, Representative Palumbo,
Here.
Representative Pratt, Representative Santoro, Representative Timoney, Representative Westrom, Senator Schickel, Chairman Koenig.
Here. We have a quorum. In your packet, we have minutes from the June meeting. Chair will entertain a motion to approve as submitted. Motion by Representative Cook, second by Representative Timoney. Any questions? All in favor signify by saying aye. Aye. All opposed? Motion carries. We have 3 items on our agenda. We're going to start with veterinary licensing. Representative Cook. I believe you have 3 guests. Y'all have a seat, and if our guests can start by introducing themselves for the record, and then the floor will be yours.
Good morning. Thank you, Mr. Chairman. I'm State Representative Matt Cook, representing the 72nd District.
Michelle Shane, Executive Director for the Kentucky Board of Veterinary Examiners.
Dr. Steve Wills, current chair of the Board of Examiners.
Dr. John Park, board member of the Board of Examiners.
So thank you very much for hearing us, Mr. Chairman, Co-Chairman Schickel. Appreciate you hearing us today. My part of this presentation, I want to stress to you how much, and no pun intended on this, how much this bill has been vetted already. We like that. We worked on this bill. We had it, staff worked on it last fall. We filed it during the last session. And since session's over, we have also had a series of stakeholder meetings across the state. And we have taken what we have learned from those stakeholders meetings. They've been incorporated in it. The changes have been made into what is before you now. And at this time, I'm going to turn over to Michelle and let her present what's actually in the bill.
Thank you, Representative Cook. I'm going to go ahead and reach in front of you there. Thanks for the opportunity to be here today and address this committee. I'm going to dive right in. Before you in your packet, I know that you have a summary or white paper, a Modernization Practice Act that reviews all of the history of the board from 1942 through current. And I can tell you that in more than 30 years, it's been more than 30 years since there's been any substantial updates to the Practice Act. And in that time, there's been a lot of changes in veterinary medicine. And
Can I interrupt you for a second? Can you
Yes.
put the microphone closer? We're having a tough time hearing you.
Sure. Is this better?
Very much so. Thank you.
Okay. Okay. So it's been more than 30 years since the Practice Act has had any substantial updates. If you would advance. The board worked intensely for more than a year on this initiative. They had multiple all-day additional meetings. They've reviewed National Practice Act models by the American Association of Veterinary State Boards, or the AAVSB, as well as the American Veterinary Medical Association, the AVMA. They've reviewed state regulations and outreach to other state boards on specific topics, like the VCPR, veterinary standards, facilities and registration, and vet techs and assistants. And we've engaged with our professional organizations here in Kentucky, the Kentucky Veterinary Medical Association and the Kentucky Veterinary Technician Association, on those edits. We've also outreached to other key stakeholder organizations, those that touch on animals and those that are just key organizations in Kentucky, as listed here. As Representative Cook mentioned, we have conducted stakeholder meetings all across the Commonwealth. This is in partnership with the Veterinary Medical Association and their regional chapters. We, at each meeting, Chairman Wills was present except for one, but at every meeting had at least 2 board members. We had 20 to 45 public participants, not just licensees. We had about a 45-minute presentation which distilled the Practice Act for them, looked at demographics data and preliminary regulations, and then we engaged in a 45-minute or longer dialogue with those folks to get comments. Additionally, Commissioner Quarles with the Kentucky Department of Agriculture brought together agricultural leadership and commodity groups with leaders from the veterinary community to dialogue in part about this bill as well as veterinary shortages. These are the 4 credentialed professions currently assigned by you to the board. And I must admit that a lot of this bill is administrative cleanup. In 30 years, a lot has changed. And we want to make sure that we have everything covered in statute, from renewal to reinstatement requirements, clarifications on controlled substance management, medical records, minimum standards, background checks to help with diversion issues, and clarifying the role of licensed veterinary technicians. Also telehealth, but I'll talk more about that in a moment. Highlights from the Modernization Act include requests for expansion of scope, educational awards, vet facility registration, and in response to stakeholder feedback, those allied professional permits and increased board authority. I have about 5 slides I want to walk through with you to touch on those. One of our biggest concerns, and that's incorporated in this Practice Act, is related to the veterinary client-patient relationship, or the VCPR. This is essential in the veterinary community to ensure adequate care of patients, early diagnosis, and the ability to quickly contain high-consequence diseases. It is also related to telehealth. 30 years ago, when our statutes were written, it was assumed that the VCPR would be made in person. And the way it's written, though, it's kind of ambiguous. And so we're looking to clarify that the VCPR does need to be established in person, especially as related to a telehealth VCPR relationship. And there's more details, again, in your packet. Veterinary facilities standards, regulation, and inspections. This is the biggest component that we heard feedback on. We estimate that 70 to 80% of licensees do support the implementation of registration, much higher support from the public. We do see hesitancy from some licensees about expanded government and additional fees, but we know that the fees would be minimal. Others strongly support minimum standards for veterinary facilities to protect patients and clients. Veterinary facilities standards and registration would allow the board to better understand and work to lessen the shortages we're seeing across the Commonwealth, help elevate the practice of veterinary medicine, and ensure that everybody has access to those minimum standards. Educational awards. Currently, the General Assembly allows for contract seat spaces at both Auburn and Tuskegee. However, those contract seat spaces don't require the awardees to come back and work in Kentucky. And so what we would like to do, as is being done in some other states like Ohio since 2009 and Oklahoma more recently, is be able to award educational monies to individuals to come work contractually back in Kentucky to ensure that we are helping to fill those shortage gaps, primarily in food animal medicine and rural communities. The allied professional permits were added as a result of stakeholder feedback. We've been contacted by the Board of Chiropractic Examiners, the Board of Licensure for Massage Therapy, and many laypersons out there who want the training to work on animals and want to make sure that they do so correctly and within the law. So we're looking to have an allied professional permit which would cover these people and protect citizens. And one of the biggest calls we had from stakeholders was stronger enforcement authority. We want to be able to ensure that non-credential holders cannot interfere in the practice of veterinary medicine. And our next steps, we intend to seek feedback continually through this process. We are planning species-specific meetings with practitioners to identify specific issues in food animal, equine, and small animal. And we're looking to coordinate with those other professional boards to make sure we're moving forward with everybody understanding the same direction. And that is all I have. Thank you.
Wills, anything, any closing comments?
I would just like to reiterate that we have really tried to be out front of our profession, even though we are, the regulatory board for the state and we work to protect the citizens. We have gone out to educate the public and our veterinarians to ensure that they know what we are requesting and what we're trying to do. A lot has changed since I graduated from veterinary school over 35 years ago, and I think we need to modernize this practice act to be where veterinary medicine is today. Thank you.
Very good.
Dr. Park, do you have anything?
I would just like to thank you guys for listening, and I would like to reiterate that we have put a lot of effort into this process, and Michelle's been a key part of that. And our efforts, Dr. Wills and I are appointed by the governor to sit on this board, but we're both also practitioners, so we're in both scopes of it. And as a practitioner, I have to look at the changes as a practitioner, but I have to look at the changes also as a board member. And I think that that they're all relative and needed. I've been practicing 25 years, and in my career, it's not been changed. And there's been a lot of changes. When I graduated from veterinary school, there was no internet. Cell phones were just coming out. And so with the advent of all these changes, I think it's pertinent and imminent that we need to be ahead of it for the protection of the animals and the public for the state of Kentucky.
Thank you all very much. I appreciate your time and look forward to any feedback or questions that you may have.
Thank you all very much. Now, you filed this year, and go ahead.
Yes, this will be ready to go on as soon as session starts up next
I
year.
appreciate everybody doing the hard work of having all those stakeholder meetings and the traveling. It's daunting and it's a lot of work, but it's important when you're going to reach a consensus on things like this. First question from Senator Thayer.
Thank you, Mr. Chairman. First of all, kudos to Representative Cook for excellent job working the PowerPoint. He may be the only legislator I know who is capable of doing such a thing. Well done. Thanks for the excellent presentation. This is the second time in the last month I've heard about the veterinarian shortage in Kentucky. I'm on the Agriculture Committee, and we heard about it recently. I think the updates to the Practice Act are worthy of consideration here. Anything to keep the two-headed monster of the big corporate types who want to come in and do this remotely, and the left-wing animal activists who want to let all the dogs and chickens and horses run free is something that I think we can find agreement on. So I certainly like that part of it. Do you think any changes in the act would be increasing the barriers to people becoming veterinarians? I understand we've got standards that we want to have and continuing ed and things like that, but we also don't want to put up any more barriers to people becoming veterinarians.
No, I do not see us increasing a burden for licensure in the Commonwealth.
What is the number one thing the General Assembly could do to help with the veterinarian shortage in Kentucky? I'm teeing this right up for you, Doc.
Yeah, I mean it's.
I know the answer. Just go ahead and say it.
Yeah, more money,
More contracts.
yeah, more contract spaces.
What about the requirement that those who use taxpayer money to help fund their education at Auburn and Tuskegee should be required to come back for at least a certain number of years to serve the people of Kentucky?
Well, here we go. I actually philosophically do not believe we should do that. And I think how I view that is we don't have a veterinary school in the Commonwealth, but we have multiple medical schools, multiple lawyers, multiple dental, and we do not impose those same requirements on those professions. So I think it's a little bit unfair because we have a really good deal, money-wise. Probably the veterinary education is an excellent value compared to if you had a veterinary school in the state and you were having to support it, finance it, staff it. Kentucky does well in this contract.
I've always been a big supporter for 19 plus years of the contract spaces at Tuskegee and Auburn, and I agree with you philosophically. That's why I've never really pushed for that sort of requirement, but it seems like we're getting into a dire circumstance here with veterinarian shortages, and it might be something that we look at least on a temporary basis.
And to that question, that is why we are saying we're willing to put up money from the board for that reason. To if someone gets that scholarship contractually, they have to come back.
Thank you, Mr. Chairman.
Absolutely. Do we have numbers as to those that we spend that money on to send them to Auburn and Tuskegee, and how many of them come back?
We did recently see a presentation from Auburn at the Agricultural Leadership Dialogue. There's actually a link to that video in your slide presentation, but they indicated it's a fairly high percentage, 80 to 90% of them end up coming back here.
Okay. Wonderful.
Yeah.
Thank you.
I think after 5 years, that number goes up close to 80%.
Okay. Wonderful. Representative Moser.
Thank you, Mr. Chairman, and thank you for your presentation. Thanks, Matt, for this good work. I am always encouraged when I see a group of stakeholders like this that have come together to really work on these issues. I think it speaks to the expertise in this field, and it's always a good thing. I just wanted to comment about I'm going to say healthcare worker shortage. Sorry, health and welfare. We passed a bill last year that expanded the loan forgiveness program for healthcare workers, and we did attach a 2-year contract to those individuals who receive that benefit and come back to work in an underserved area. So there are ways to look at this. I'm not sure what sort of taxpayer benefits the students are actually receiving when they go to our reciprocity universities. But I mean, maybe that's something that we could look at and as a way to recruit individuals back to Kentucky. I have a quick question about, you mentioned scope of practice and who are those individuals and who would come in? Is this a team-based approach, I would assume, and who are the...
So there's two issues there. There's one, the veterinary facilities, which we're hoping to identify all the veterinary facilities in Kentucky so that we can help with the shortages. We have to know which facilities exist and where before we can identify the key shortage areas. But the other, the allied health professional, which I think is what you're asking about. Mm-hmm. We have two groups of people. We have the professional human health care workers who are certified by their professional board who want to enter into the field to work on animals concurrently. And then we have lay persons who become trained through various schools across the nation with no accreditation standards that we feel we need to set some standards for. And because cross-species work is so delicate, we want to make sure that everybody, whether they're professionally trained in that area or not, has the right experience and training to do that work.
Okay, good. That gives me a little comfort. I always like to hear credentialing and training and ensuring that we are allowing only those individuals who are appropriately trained to come in and practice. So, all right, thank you.
Thank you.
Senator Thomas.
Thank you, Mr. Chairman. Representative Cook, this is called a Modernization Act. And understanding that the last time you did anything major was 1998, I can certainly understand why the practice needs to be updated and modernized in 2022. I agree with that. Obviously, I think some things need to be done. But I am curious, and help me understand this, as to why we want to why we would want to maintain the in-person requirement. And I ask that because when I heard that, I have a professional license as well. And there's no requirement that I be retained or retain someone in person. I mean, I know that I've retained attorneys from out of state to do certain things, and that's never been done in person. It's always been done online or on telephone, and vice versa. I've been retained to do from outside, people outside Kentucky to do legal work. And again, it's never been in person. And if we're going to modernize this, and we live in an age of technology and internet or broadband, why would we want to maintain something that seems archaic to me in the in-person requirement? I just don't see that as being modernization.
Senator Thomas, thank you for the question. I'm going to let Michelle talk about this. We actually had some dialogue on this in the last 2 days here, so I'm going to let her handle this.
Yes, we have received feedback letters from national organizations asking similar questions to you. But what I want to underscore is that in veterinary medicine, work on animals, the animal can't speak for itself. The requirement to have the in-person visit is once per every 12 months. And so for the rest of that time, the other 12 months, you can do online telehealth. You can have online interactions and care with technology. However, the veterinarians, and I would ask you all to speak on this, really need to have all 5 senses in touch with that animal to make correct diagnosis, to identify early disease issues, etc. Dr. Wills, did you want to add, or Dr. Park?
Go ahead, John.
I'll speak to this. I agree with Michelle. It's once in 12 months. And another point, in our 10 stakeholder meetings with the veterinarians across the state, we were 100% unanimous support from veterinarians for the once of 12-month visit. But I'm an equine practitioner in central Kentucky, and I'll give you an example. And I told this to the board a month ago. I had a lady bring me a horse, and she said, "Doc, it's lame in the left rear," and she was confident it's lame in the left rear. I have to touch that animal. I have to put my hands on it. I have to watch it jog. I have to flex its legs, and it's lame in the right front is where the horse was lame. And I showed her. I numbed the nerve, and it went sound. Showed her right where it was lame, and that can't be done visually on telehealth. Now, there's certain things that can be done, and we're saying that in that other 11 months and so many days of the year that you can do that with telehealth. But that initial examination is essential to be in person, and I'm speaking from a practicing veterinarian daily. And then there are things that the rest of the time you can do. We do telehealth every day. Clients, Matt, Representative Cook's one of my clients. He'll text me, "I need this. What do you think about this?" And we're performing telehealth. But I've got a relationship with him. I'm at his farm regularly, and at least once in 12 months. So, thank you.
Another key issue, too, is, to that point, is what are our obligations as the board that protects the public? How do we handle someone that is sitting in California diagnosing, maybe incorrectly, and prescribing, maybe inappropriately, controlled substances, whatever? But what is our recourse? Sure, they're licensed, but they don't reside in the state. We can reject their license, but they can still continue to operate outside the law if they choose to do so. And so we're seeing some issues. We see this with internet pharmacies. We've actually are working on something with the Board of Pharmacy right now. So we have these things that are coming because of the internet. So what we're trying to do is be ahead of that curve and kind of cut that off. Plus, to reiterate what Dr. Park has said, our veterinarians are 100% in agreement. I mean, and if you get veterinarians to be 100% in agreement on anything, it's pretty amazing. But at our stakeholder meetings, that was the one key issue that veterinarians that came to those meetings said, we agree with the in-person VCPR.
Does that cover everything, Senator?
For now, it does, Mr. Chair. Thank
All
you
right,
very much.
very good. Representative Timoney.
Thank you, Chairman, and thank you for this excellent presentation. Wow, there's a lot of information in this. It seems like you guys have vetted literally everything. No, not to replay your joke from earlier.
It's well vetted.
It is very well vetted. This is a topic that's near and dear to my heart. My father's a veterinarian. My uncle's a veterinarian. My grandfather, my great-grandfather, my great-great-grandfather. So this is something that's really, really important. I see the tremendous value here. I see the tremendous value in the pushback on telehealth. I mean, like you said, Mr. Ed came along once in a lifetime. The talking horse. Okay, we don't have many options like that where it makes the job super, super easy. So I understand that the skill that's necessary in order to be a good veterinarian. Couple questions. First, recruitment. What are we doing for recruitment? I mean, I'm talking at the school-based level because obviously I'm going to tie everything back to the education system. What are we doing there? Because I can tell you, as a former teacher, I had students that would come to me and say, "Listen, can I talk to your dad about being a veterinarian?" And his first reply was, "Don't be small animal." Just because he saw the dire need for large animal vets and how we were having a tremendous shortage. But could you talk a little bit about recruitment efforts that you all are looking to deal with that?
Sure, I can tell you that when you talk about veterinary shortages as a large topic, there is no one single solution that's going to be the cure-all for this issue. Recruitment is something that has come up recently when we start to talk about funneling students into animal science and biology programs and then into vet medicine. I'm happy to share that the Kentucky Veterinary Medical Association, KVMA, has started a student chapter program in Auburn and intends to expand to other colleges to get those folks to come back here to Kentucky. But recruitment is just one aspect, certainly. We are hoping to increase our education and outreach efforts at that grade school level.
I have a brief follow-up. I have been fortunate to be the son of a professor who taught at vet schools, and I've seen the need, and I've heard about it for a long, long time about the desire to have some closer by. Are there within 6 hours of Lexington or of Kentucky, for that matter? We're looking at Auburn, Tuskegee. What else? What are other options for people who want to go to vet school?
Lincoln Memorial University, Ohio State University. There's Virginia, Maryland Veterinary College, Purdue.
Tennessee,
Ohio State.
There's a few around us.
Okay.
Yes, sir.
University of Missouri.
The reason why I bring that up is I've had several students who have gone this route and they've never come back. They've stayed in Alabama. The state of Alabama has embraced them. They wait at graduation and say, "Hey, we have a job for you," or this is what we have available for you. I can't stress that piece enough. If we need to start exploring or having discussions about having a local, I think it's a very, very valid concern, and it's a very I know it's a big ask for this particular problem, but our large animal vet services are lacking, and we are in dire need. And I do think that we need to be aggressive with that. Thank you.
If I may add, that the board has initiated a program, licensure on day of graduation, that we have partnered with Auburn and Lincoln Memorial University and are looking to expand that to ensure that we can get those students back here to Kentucky.
Representative Meredith.
Thank you, Mr. Chairman. And I want to piggyback on some of the questions that Representative Timothy and Senator Thayer asked, and I was a little late, so I apologize if you went over this, but disparity between shortages in the large animal and small animal field, can you bring that up? You may have talked about it in the presentation, and I apologize for being a little late. I had another meeting this morning.
Yeah, we did not touch on the demographics that much, but what I can tell you is that there are shortages across the field. We have shortages in small animal where we have ER wait times of 8 to 10 hours. We have about 1,600 practicing vets here in Kentucky listing a Kentucky mailing address. About 1,300 of them work in small animal, around 350 full-time equine, and only about 50 for large animal. full-time. Now, we do have mixed practices. The shortage is definitely to the rural areas and the large animal, but we can still say there's shortages across the board.
And then a follow-up question, if I may, Mr. Chairman. My follow-up on that was kind of to the point that Leader Thayer brought up about how to manage those slots. Would there ever be a chance, or would there be a need for us to look at prioritizing folks who are willing to commit to large animal veterinary work versus small animal work?
So we are already in discussions with both the KVMA and Auburn and several other schools about how to change their screening system, the entry, allows entry into the vet schools. They are already adapting that to allow for lower GPA. Doesn't mean that they're not going to do as well in vet school, but that they have the skills and the propensity to come back here to Kentucky and rural and large animal work.
Thank you very much.
That's all the questions. Thank you all very much for the presentation. We appreciate it.
Thank you for the opportunity.
Thank you.
Absolutely. Next up, Speaker Mead. And our friends with the Realtors. Speaker Mead, we wanted you to hear all about our vet issues as well. So, welcome to L&O, by the way. Floor is yours.
Thank you, Mr. Chairman. I appreciate the welcoming this morning. What we're going to talk about this morning, first of all, I'll introduce myself. I'm David Mead, Speaker Pro Tem of the House. My guests will introduce themselves.
My name is Justin Landon with the Lexington Bluegrass Association.
I don't think your mic's on.
Got it.
There we go.
My name is Justin Landon with the Lexington Bluegrass Association of Realtors.
Thank you. Josh Summers with the Kentucky Realtors Association.
Well, thank you again. I'm going to keep my comments very brief and let the experts testify to what we're trying to do here. But we're trying to look into the issue of wholesaling. Wholesaling in real estate has become a problem not only in our state but across the country as folks are trying to figure out the best way to deal with that. If you don't know what wholesaling is, very quickly, wholesaling is when an individual, the wholesaler, enters into a contract with a property owner, and then they turn around and advertise that contract in the same manner that a licensed real estate agent would to an end buyer, who then agrees to pay a higher sale price than that contract. They then assign that contract, in essence, sell that contract to that person. And at that time, they have no intention of buying the property. They have no intention of taking deed to that property. And if the contract falls through, the wholesaler then walks away. And while this is occurring, it's leaving the consumer, both the seller and the buyer, at risk because there's no accountability or transparency in the process. I will say that the talking points, I filed a bill that was going to simply fix this issue. It was one line in two sections of statute. And the reason that we need this is because they feel they found a loophole that says they have an equitable interest in the property when they put down, say, a $500 option or deposit or whatever it may be on the property. And they say they have a right to then sell that property as for sale by owner. Now, for sale by owner actually falls under a different statute in law, and if you are going to be an owner of a property, that means you actually have the deed to that property. So they actually wouldn't fall under that, but under real estate law, they feel like they found that loophole. And so in the bill that I had done this last session, just to start the conversation, it was one line that says that adding under real estate brokerage that it includes advertising for sale and equitable interest in a contract for the purchase of real property between a property owner and a prospective purchaser. So that was all that we did in that bill, and that's what it will be as we come back this next session. But that just gives you kind of a brief rundown on how wholesaling works, and I will allow my guests to give any testimony that they would like.
Thank you, sir. Thank you, Chairman Koenig, Chairman Schickel, and members of the committee for your time and attention today on this important issue of consumer protection. Before we talk about what the bill does, I think it's important to talk a little bit about real estate brokerage in the state of Kentucky. KRS 324 defines real estate brokerage as an entity that sells or offers to sell, buys or offers to buy, negotiates, manages, leases, or rents real estate for compensation. And it says that if you do those things, you need to hold a valid Kentucky real estate license issued by the Kentucky Real Estate Commission. And the answer is why? Why do we need to be licensed if we're going to do those things? Because for most Americans, real property is the largest asset they own. And for many, it is the most significant financial decision they'll make in their lifetime. It's how many Kentuckians build generational wealth. It's how many will have the means to retire, to send their kids to college, or to afford health care in their later years. We license real estate agents in the state of Kentucky and every other state in the union because property ownership is central to the American dream. With that in mind, the Kentucky Real Estate Commission establishes that a real estate licensee in the state of Kentucky owes a fiduciary duty to their clients. There are not many professions that have a legal fiduciary obligation. Lawyers, medical doctors, certain financial advisors, and real estate agents. Real estate agents owe by law a fiduciary duty of obedience, loyalty, disclosure, confidentiality, care, and accounting. This means a licensee in Kentucky must put the needs of their client before their own. In addition, the Kentucky Real Estate Commission requires that a real estate licensee owes a duty to any consumer of good faith and fair dealing, not just a client, any consumer. With this kind of general baseline surrounding real estate licensees in the state of Kentucky, let's talk about the legislation before you today, which seeks to further define real estate brokerage. As Representative Meade laid out, his bill would make it unlawful for any person who is not licensed as a broker or agent to advertise for sale an equitable interest in a contract for the purchase of real property. The practice he's talking about, as he said, is wholesaling. But I think it's important that we define what wholesaling is not, because there's a lot of confusion on this topic. Wholesaling is not purchasing a property, renovating it, and then reselling it. That's typically called flipping, and that's not remotely what we're talking about today. It's also not closing on a property and then reselling it. That's called buying low and selling high in a normal business transaction. And it's not simply assigning a contract to another party. That happens all the time between different business entities or between family members. What we're talking about when we talk about wholesaling is the process of entering into a contract, selling the paper to someone else for a profit, and pocketing the difference of the original sales price. Wholesaling typically targets distressed properties, where an offer is made at a price lower than the property is worth, then the contract is sold on to a different buyer for closer to its actual value, and the wholesaler pockets the difference. The selling of equitable interest in a property is taught in seminars across the country as a way to get rich quick. You've surely seen the signs in your community, "We'll buy your house for cash." Many wholesalers use postcards and dialing systems to generate leads and typically need thousands and thousands of touches to generate a single lead. And typically, as Representative Meade said, if the wholesaler can't find a buyer, they just drop the contract during the due diligence period, leaving the seller holding nothing except wasted time. This doesn't make sense, and it doesn't serve consumers who believe when someone offers to buy their house that they're going to make a good faith effort to buy it. Or if someone is claiming to be shopping that property to another buyer, they have every expectation in the state of Kentucky that that person is a real estate licensee who has their best interests at heart. Wholesaling's been practiced in Kentucky for a long time across the country. It's not really new. So why are we asking for legislation now? The reality is in the last 3 years, we've seen an unprecedented rise in the value of property. In downtown Lexington, we've seen a 44% increase in the value since 2019. That's 5% faster than the rest of the community. But it's not just an urban issue. The city of Corbin, since 2019, has seen a 60% increase in the value of a home. In real numbers, that's $125,000 to $200,000 in 3 years. As the market has expanded, so too have the number of people who are wholesaling and trying to take advantage of this rapid rise in value. To put that in context, normal appreciation of real estate is somewhere between, historically normal, is somewhere between 2 and 4%. Even experienced, everyday buyers and sellers of real estate are having a hard time keeping up with today's values. The legislation before you today does not seek to make it more difficult for property to be bought and sold. It seeks to ensure that everyone is treated fairly as the law requires when someone is making money brokering a deal between a buyer and a seller. Nothing in this legislation will hinder a property owner from selling a property themselves or any buyer from purchasing a property and assigning the contract to another person. What it does do is ensure that if someone holds themselves out to the public to sell a property they don't own and collect a fee for that role, they should be licensed. If we go back to the start of this presentation, why we license real estate agents in the state of Kentucky, don't we owe it to our neighbors to ensure that if a wholesaler is making money on a consumer's asset, that they be subject to the same fiduciary requirements as every other person brokering real estate in the Commonwealth? Thank you for the opportunity to address you today. I'd like to introduce the Kentucky Realtor CEO, Josh Summers, to conclude our presentation.
Thank you, Speaker Mead, for your sponsorship of this bill. And thank you, Chairman and committee members, for your time today. Again, my name is Josh Summers, and I have the honor of serving as the Chief Executive Officer of Kentucky Realtors. The relationship between Kentucky Realtors and the legislature has never been stronger than it is today, and we look forward to continuing to build on that relationship with you in the coming months. Thank you again for giving us the opportunity and time to present to you today on this very important measure. We will be glad to answer any questions you may have.
All right, thank you all for the presentation, and Mr. Summers, welcome to Kentucky. First of all, Representative Bratcher.
I guess the word wholesaling kind of threw me off on this, so I'm kind of slow on this. So is this like a finder's fee? Is that what we're talking about?
Not exactly. I can see where that would come from, perhaps from another industry, or there are finder's fees that do get paid in various real estate transactions. What this is really is a person goes to a seller and says, "I think your house is worth $50,000, and you should be worried that prices are going to go down soon, so you should lock that in for $50,000 now, knowing whole well that property is worth substantially more on the open market." And then they take that contract that they've entered into for $50,000 and they shop it either publicly or to a class of investors that they have a relationship with or a class of buyers they have a relationship with, and sell it for what it's actually worth and pocket the difference. And the seller, not necessarily understanding the real estate market, have now been taking advantage of someone who knows the market better than they do. And they've lost out on what is likely to be thousands and thousands of dollars of value in their home.
So that's not illegal, right? I mean, sounds like fraud. Or
it would be illegal for a real estate licensee today to do something similar.
Thank you.
That's generating a lot of questions from folks. Representative Flannery.
Two questions. First question, there's, I guess, somewhat of a similar concept of a double closing. Would this prevent that? And I guess my concern would be that in a double closing, you've actually closed on the property. There's not an equitable interest that it's been purchased. Presumably a deed would be signed, hopefully recorded. It would appear to me that might be a kind of a similar approach or concept, if you all would like to discuss that. Secondly, okay.
Thank you, Mr. Chairman. Double closing, so everybody's just clear on what that is. And back to my example a moment ago, I've entered into a contract to purchase a property. I go and find a buyer. I actually close on the property and then immediately sell it to somebody else and close immediately. Nothing in here would prevent a double closing scenario, but it would prevent someone marketing the equitable interest in that contract before they close on it without utilizing a real estate licensee to advertise that property. Back to the point that a real estate licensee holds themselves out to the public to be a fiduciary. I'm offering someone else's property for sale, and you know that there's a fiduciary obligation, an obligation of fair dealing, and so it wouldn't prevent the double closing at all, but it would prevent the marketing of equitable interest prior to that closing.
Representative Flannery, my experience with that I have with some of this is that the people that I have know that have been taking advantage of this are mainly older folks who don't know the market or are in distressed situations where they're starting to kind of panic because they're possibly getting foreclosed on, whatever it may be. They come in and say, I came to you and I said, okay, I meet with you, I talk to you, and I find out, well, you're a pretty educated person on the market. And many times I'll say, okay, you know what, it's probably not the deal for us to do. I appreciate your time. I hope you sell your property and I leave. But if I come to you and I see that you don't understand the market completely, I'll make you that offer. Talk to you about how things could change quickly in the market, get that deal done with you, and then go on to advertise the property, which is that's where it starts to get into more of real estate law. You're advertising that property for sale without having a brokerage license, and then there's no real recourse. Well, there is recourse for some of these folks, but it is costly and timely. And with KRAC being involved, it would speed that process up for those who are looking for some recourse.
Yes, Representative Meade touched on some of that for my second question. I guess the second part, I guess I would agree that typically the purchase of a home is probably the most important financial transaction that someone would make in their lifetime, or and that there is a consumer protection issue there. But I guess help me appreciate some of the other examples of consumer protection that's needed. Representative Meade, you discussed, I guess maybe it's been your experience that elderly people, this might be needed for them. I guess help me understand why this is not really just a free market issue, and where you've got transactions taking place, and why it's needed to protect people.
I think it's the free market issue is the when you're advertising that property, and there are laws out there for that purpose of advertising real estate. When you are not the owner of a property, if for sale by owner, that owner can sell that property anytime they want to. But when you are representing someone, or you're representing a property, trying to bring a buyer and seller together, there are fiduciary duties there that should be included with that, and that are not included unless we add this portion to that piece of KRC law.
Okay, thank you.
Representative Palumbo.
Thank you, Mr. Chair. I just want to thank Speaker Meade for bringing this piece of legislation which will protect the Kentucky consumer, and I would like to ask to co-sponsor, sir.
Well, I'll be glad for you too.
Thank you for bringing this.
Thank you.
Thank you. Senator Thomas.
Speaker Meade, and I'm sure I'm not alone in this. So every day when I get those annoying phone calls or text messages that say, "Do you want to sell your property?" Okay, are these wholesalers now that are doing this? Is this part of their 1,000 calls a day to try to find someone who's going to do that? Is that what I'm listening to now?
I'm sure that some of them are. I get some of those from time to time from some real estate agents myself, but I think that the no-call list would help us out. I need to call and make sure that my number gets put on that list again.
Very good. Representative Gentry.
Thank you. Excuse me. Thank you, Mr. Chair. You may not know this, but I'm a real estate investor and have been I've owned a small business real estate investing company in single-family housing, mostly for 20-something years. Fully understand wholesaling. Fully understand how the market has changed considerably. Not only are prices going through the roof, I think what we're seeing too the last few years, and you probably agree with this, is a lot of investment money coming into the market buying properties for retail value, which that didn't happen hardly at all. And when I say retail value, I'm talking about, well, I would just say the way I learned purchase real estate, there's a lot of overpayment for real estate. I think there's a lot of money going into real estate, and they're banking on appreciation as part of their investment strategy to a certain extent. I don't want to get in the weeds on that because it doesn't really have a whole lot to do with my question. I'm trying to understand the impact of this. First of all, as a real estate investor, I understand when you have activities going on that are not policed, there are always unscrupulous people out there. They often give us all a bad name. So just because I'm an investor and an investment owner doesn't mean that I don't want some sort of tight control on this, because I've seen some unscrupulous wholesaling methods. And I think a lot of it comes from seminars and getting people all jacked up about going out there. We're going to be a get-rich-quick scheme. Anybody that owns businesses know it's not. Nothing is a get-rich-quick scheme. It takes a lot of education, a lot of time, a lot of hard work, quite frankly. And there's a lot of good people in the investment business as well that provide a certain niche, especially in the foreclosure market. Many of the years I've been in this, it hasn't been easy to sell properties that are in need of a lot of work. And in many times, it's not in a real estate agent's interest to try to list those types of properties because they're almost unsellable, and that's when you need the niche of an investor to come in there. My question is, I'm sorry about all that. My question is, as a retailer, I've been mostly a retailer over the years, and I've done business with wholesalers. Not only do they bring us deals from time to time, we often get into a business where we are making offers on properties at a large number, a large volume, because most of them obviously get rejected. In order to run the business and keep it going, it's important to keep the funnel full on prospects. Sometimes you get in a situation where, and by the way, when we make those offers, it's every intention to buy and get that deal, because if I wasn't going to make money on the deal, I wouldn't make the offer. Okay, we look at it as we make our money at acquisition time if we buy right. There are times where we get a couple of offers more than we intended accepted. So I might call a wholesaler, or I might call another retailer, I should say, and say, hey, how busy are you? I've got a property here. And I flip them the property and make a couple of thousand off the deal for my time and effort. Now, when we do that, we do simultaneous closings, double closings. So I think Representative Flannery addressed this question. That process would still be legal if we pass this, correct? You just can't advertise. So it would change the market to some people, and it would be very beneficial to have your buyers list and people that you already work with that might be other retailers. So you might be. Are you following what I'm saying? I'm just making sure that this doesn't in any way stop my business and other businesses like us who are actually retailers from flipping a property through a double closing or simultaneous closing to another retailer.
You're exactly right. It comes down to the advertising of that, and you had several things that you said in there that were key to this. You have every intent of buying. You have every intent of taking that deed. I myself buy and sell houses from time to time as an investor, as a single investor, and I will buy some of those distressed properties. But as we said, we have every intention of taking those deeds. We also are not tying them up with any type of contract or option. So that's another issue, is that on these distressed properties, for those folks who may be on the verge of foreclosure, needing to get rid of something quick, many times they can get tied up in these contracts and then time run out on them. So they're needing to get a buyer who's actually going to take deed and buy it as quickly as possible. So those are some of the issues, but what you said is exactly right. Because you are not advertising that property, this would not relate to your situation.
Okay, thank you for that. And out of respect for time, I won't do a follow-up. I'll talk to you later.
Thank you. We got four more. Representative Cook.
Thank you, Mr. Chairman. This is personal with me because my father died last year, and immediately after the obituary came out, my mother has received a postcard, a letter, a phone call. It was much more frequent last spring. It's probably down to about 1 or 2 a month right now, and we get them. I laugh, she laughs, offer $100 an acre more. She throws me out of the house. But the point is that they're offering well below market value. It comes in that, this is property that's worth probably $7,000 to $8,000 an acre. They usually offer $1,500, $1,800 offer that. My mother's not going to fall for it, but they're preying on a very, very vulnerable population out there in cash money, and when you got funeral expenses and retirement and everything else to worry about. And I'm quite certain that people in my district have fallen prey to this, and I appreciate you all bringing it forward.
And that's what we do in this committee, is figure out the line of what is proper public protection and looking out for others and not trying to interrupt the market. Representative Pratt.
Well, actually, Representative Meade stole some of my thunder, but what was called what they are? These are predators. They prey on the elderly and people distressed. And if, much like Senator Thomas, if this will stop the phone calls, the texts, and the postcards that I get at least twice a month, I'm all support this bill. But it's a great bill. Thank you, guys.
Well,
Senator Nemes.
You may need to extend your car warranty or something like that.
Senator Nemes.
Thank you, Mr. Chairman. I used to flip houses and invest in real estate long before flipping houses was on TV, and end up having to rent a lot of them because you couldn't flip them as easy as they say. But excuse my ignorance, but I'm still not sure what wholesaler is. Is it someone that purchased an option? Did the owner actually sign a contract? What's illegal about that unless the contract is to put buyer and seller together, and there's already laws on the books for that with a licensed real estate agent. So explain to me exactly what you're doing if I come to you and say, hey, I want to put a option on your house. Now, it sounds like the options are for $0, but that's still...
You're right. They enter into a contract in a couple of ways, but the issue is not the contract. The issue is after that, the going out and then advertising that property, never intending to take possession of that property. The advertisement of that property in a manner that would be equal to what a real estate agent is doing. That right there should bring in that fiduciary duty that you've got to be fair, honest with that buyer, and you've got to be fair and honest with that seller, and that the details of that entire process must be laid out at that point. It's for that protection there where, as I said, could be taking advantage of, not everyone, but could be taking advantage of those who don't know the market. And typically, most of the money is made in these hot markets like this right now, where you've had a drastic increase of values. Folks don't know what the value of their property are, and that's what they're looking for, is someone that doesn't know how that market works.
Well, the purpose for an option is an option to purchase, not necessarily need or have to purchase. Is this option, or is this contract keeping the buyer from selling his property? I mean, usually if you have an option, that means you have an option to buy the property, but you could still sell your property, and then you go to the person with the option and says, okay, you have to go along with the contract. I've got somebody who wants to purchase it. In other words, you have to come through with what the contract says. Do you have any one of these contracts we could look at to see exactly what we're looking at?
So obviously there are many different contracts that are used in these scenarios. I'm sure some do use option contracts, but I think typically what we see is a pretty standard offer to purchase contract with a standard due diligence period during which the contract can be shopped. And then really what they do is, once they find somebody who's interested in the property at a higher price than they've already agreed to with the seller, they are then selling the assignment of that contract. So most contracts are assignable unless there's language in the contract that prohibits assignment. Certainly the real estate contract promulgated by our organization is not assignable, but the ones that they use are. And so they're marketing the property and then getting somebody to pay them for the paper, and then they're assigning that contract, and then the new party closes on it.
I understand that, and for interest of time, I need to talk to you, Speaker Pro Tem, later about this, because I totally am not for this, because I'd like to write some options and make some money off of it. I don't see a reason why we can't. I think there's laws already saying you can't go advertise my property without an option and stuff unless you're a real estate broker.
Well, you can't really go and advertise a property for sale with just an option on it without, you're not really the owner of the property. So you don't fall under the for sale by owner laws at that point. The option is really just, the contract is to get into the loophole of, now I can say I have an equitable interest in this, which
you do if you agreed to write that option with me.
You do, but you do not fall under the for sale by owner laws that they are claiming they do to be able to sell the property at that point.
And finally, Representative Meredith.
Thank you, and I just want to echo kind of what Representative Pratt and Representative Cook said. I happen to own a piece of property with my brother that has been in our family for quite some time, and we have been holding on to that property because of development around it and just waiting to see what's going to happen with some things. But we get those same offers that Representative Cook was talking about, and again, we laugh at them. I get one about every 2 or 3 weeks. My father and grandfather bought that property when I was in high school, so we're talking about roughly 20 years ago, for about $60,000. It's PVA valued at $50,000 or $60,000, and we know that generally PVA values are lower than what the market rate on those are. But I never get an offer from those folks that are making those offers for over $20,000, and they tell what a great deal they are giving me in those letters that they send. And it truly is what Representative Pratt said. It's predatory. I don't begrudge anyone making a profit, but make a fair profit. Treat people fairly. What they're doing is they're taking advantage, like Representative Cook said, of a vulnerable population of people who have been affected by deaths in their family, elderly people, and others who don't know what's going on in that market right now and who may need money right then. And it's really not even about an option, because most of the time when we think about options, I think we think about commercial property. Many of these are residential transactions where somebody believes that when they sign that contract, they are signing a document to sell their home to that person that's signing the document. And you can't even really call it an investment, because when you're putting down a $500 or $1,000 earnest money deposit on something that's worth $60,000 or $100,000, can you even consider that a fair investment? And so it's not even investing, it's just turning around and taking advantage of people and trying to make a profit off of that. And it could very well be called fraud, but again, they found a loophole in the law. So let's clear up the loophole, let's fix this, and let's protect the consumer.
Sounds like this business model is keeping the United States Postal Service in business. Thank you all for your testimony. We appreciate it.
Thank you, Mr. Chairman.
We can have this conversation again in January and February.
Thank you very much.
Thank you. All right. Last but not least, Representative Bratcher.
Thank you, sir.
So we put some time constraints, as it were, on this. We have Chairman Pratt has a meeting at 1. Some of us want to eat before we do that, so if we can, if you can tell us everything we need to know and nothing more, we would appreciate that.
I've brought some folks here. My name's Kevin Bratcher, and go ahead and introduce yourself.
I'm Tom Wright. I'm the financial officer for the
We need you to turn on your microphones, please.
Make sure it's green.
I'm Tom Wright. I'm the financial officer for Amvets Post 1 in Louisville, Kentucky.
Sherry Sanders, Charitable Gaming Chair.
The Mr. Wright came to me. I'll be quick. He came to me with an issue that sounded reasonable that we should try to fix. This was over a year ago. We're going through the due diligence of coming before you in the interim to get your take on it and give you some information. So I'll hand it over to Mr. Wright at this time.
Yes, I've distributed an Excel spreadsheet of our second quarter financial report for the gaming in 2022 here. It's required by statute that a deposit has to be made every 2 days following an event. It was always my understanding that an event was like a picnic or a night at the races, where you brought the income in, you paid the bills, and what was left was profit. You immediately deposited that. They now require that it's now assumed that an event is a daily pull tab sales, whether it be electronically done or paper pull tabs. And those profits deposited every 2 days. So the spreadsheet here, the green are the days that I'm required to make a deposit into the gaming account. For the very first one, if I make a deposit on Monday morning, then at the end of the day, on the first Monday there, I'm $677 in the hole. So we're just a small organization. Most of the veterans posts now are small or going out of business, and so this is something that directly impacts us. this financial officer is just a voluntary position. I have a full-time job, so trying to balance getting the deposits in and tracking all of the sales and profits is a chore in itself. So what we are asking is that with this bill, that if we don't make so much profit that we can move it to deposits once a week. This would greatly help us, and I know other organizations are struggling with this as well.
Have you anything else? We appreciate
Yeah.
your brevity.
Mhm.
Have you've spoken to Charitable Gaming, I believe, about this? And
Yes.
I don't know if
Yes.
any of them are in the audience here today or not, but
They refuse to talk about it to me. I mean, I shouldn't say refuse. It's just I don't think they're ready. They don't want this to happen. Now, these amounts we're talking about are really low. I mean, obviously this law or this reg was put in to prevent, some of the horror stories we heard about bingo when it first started in the 90s. People pocketing $80,000 and $100,000 in their closet of cash. We're talking some serious low amounts of money here, and a lot of these groups are veteran organizations. I think we can trust them with a few $100s for a few days, so they can get to the bank account to make a deposit instead of depositing every day or every other day. That's my take on it.
okay. You have a question, Representative Barrington?
Did you clarify the definition? Because I don't think a pull tab is an event. I mean, has the definition definitely been clarified with the charitable gaming?
I spoke to Stephanie Ledford. She's the financial person for the gaming commission, and she said that's the law requires pull tabs to be a daily event.
I have to go in every day and count the pull tabs and what we bring in, count what we pay out. I have to do that every day so that we can make a deposit on Monday, Wednesday, and Friday. And if I make a deposit of what we profited that day and then the next day I have to pay out a large pull tab, I don't have the money to pay it out because it's now in the bank. So it's really hard to deposit on Monday not knowing what someone's going to win the next day. You understand what I'm saying? And then I'm required to go in there each day and pull the pull tab machine, count the profit, and then count the loss and keep track of that.
Any other questions? All right. Thank you.
I will file the bill, and hopefully we can pass it next session.
All right.
Thank you.
Thank you all.
Having come to the end of the agenda, I believe our next meeting is August 24th here in Frankfurt, the day before we all go to the State Fair for a bevy of meetings. And otherwise, thank you for your attendance. We stand adjourned.
Thank you, sir. Elizabeth Moore. Yes, sir.
I wasn't out there last night, but no, I was playing basketball, much safer activity. That's what I heard.